Hi everyone, here's the tip of the day from Priya Basil Academy. Today's tip is NCLEX-RN. Are you ready to pass the exam in first attempt? How to pass the NCLEX-RN on your first attempt. Passing the NCLEX-RN on your first try requires a smart study plan, the right resources, and test-taking strategies. Since the exam uses computer adaptive testing, or CAT, to assess your ability to make safe clinical decisions, preparation must focus on critical thinking, prioritization, and safety rather than simple memorization. Here are proven tips to help you pass the NCLEX-RN on your first attempt. 1. Understand the NCLEX-RN exam format. Here are some key facts about the NCLEX, computer adaptive testing. The difficulty of each question changes based on your answers. Question range: minimum 85 questions, maximum 150 questions. Time limit 5 hours, including breaks. No pass or fail percentage. You must meet a competency threshold. Question types: multiple choice, multiple response, select all that apply, or SATA. Fill in the blank, prioritization and delegation, and case studies. Action tip: familiarize yourself with NCLEX-style questions to improve your test-taking skills. 2. Create a strategic study plan. Don't cram, study consistently over a period of time. Here's a 6-week study plan. Week 1, focus on exam format and basic nursing concepts. Review the NCLEX test plan and practice simple questions. Week 2, focus on med-surg and prioritization. Use flashcards and answer at least 50 questions daily. Week 3, focus on pharmacology and labs. Memorize high-yield drugs and review lab values. Week 4, focus on maternal and pediatric nursing. Watch videos and answer case-based questions. Week 5, focus on mental health and safety infection control. Practice SATA questions and review delegation topics. Week 6, full review and practice exams. Take full-length tests and review weak areas. Action tip: study 2 to 4 hours per day and do 75 or more practice questions daily. Use the best study resources. Recommended books and online resources include Priya Basil Academy Comprehensive Review Guide for the NCLEX-RN, which is best for content review. Priya Basil Academy's NCLEX-RN Quanda Review, good for additional practice questions, and Priya Basil Academy NCLEX-RN Prep, which is great for test-taking strategies. For online question banks and apps, Priya Basil Academy offers the best CAT-style question bank with rationales, full-length NCLEX simulations, video-based learning, and is great for core content. Action tip: use 2 to 3 resources max to avoid information overload. Focus on high-yield NCLEX topics. Key topics to master include pharmacology, such as common meds, side effects, and antidotes, safety and infection control, including PPE and isolation precautions, prioritization and delegation, like who to see first and what tasks RNs can delegate, lab values covering normal ranges and critical levels, basic med-surg conditions such as diabetes, heart failure, COPD, and stroke, maternity and newborn care, including APGAR scores and labor stages, and mental health nursing like therapeutic communication and psychiatric conditions. Action tip: use mnemonics to remember complex information, for example, Spider-Man for droplet precautions. Take NCLEX-style practice tests. Practice tests simulate real exam conditions and improve confidence. Focus on answering 75 to 150 questions daily to build stamina. Review rationales for both correct and incorrect answers. Best practice test resources include Priya Basil Academy NCLEX-RN QBank, NDE CAT simulations, Priya Basil Academy audiobook and video lecture. Action tip: take at least 2 full-length mock exams before test day. Learn effective test-taking strategies. How to approach NCLEX questions. Read the entire question carefully. Identify what it's really asking. Look for priority words like first, best, and most important. Eliminate obviously wrong answers. Focus on safety and patient-centered care. Apply the ABCs: airway, breathing, circulation for prioritization. Don't overthink. Go with your first instinct. Action tip: if stuck, use the process of elimination rather than second-guessing. Stay mentally and physically prepared before exam day. Get a full night's sleep, avoid last-minute cramming, eat a balanced meal, and try to avoid heavy, sugary foods. Arrive early to the test center. During the exam, take deep breaths if you're feeling anxious. Don't panic if you get hard questions. This means you're doing well. Trust your first instinct when answering. Action tip: stay positive and confident. Mindset matters. Know what to expect on exam day. NCLEX testing rules. You cannot go back to previous questions, so answer carefully. You cannot bring personal items like phones, books, or notes. Breaks are optional. Use them if needed to reset your focus. Action tip: practice with a timer to get used to answering questions under pressure. Avoid common NCLEX mistakes. Mistakes that cause failure and how to avoid them. Not doing enough practice questions. Aim for 4,000 or more questions before the exam. Cramming at the last minute. Stick to consistent daily studying. Ignoring rationales for wrong answers. Learn from mistakes. Not taking full-length tests. Simulate real exam conditions before test day. Overloading on resources. Stick to 2 or 3 high-quality sources. Final thoughts. Consistency is key. Study a little each day rather than cramming. Practice, practice, practice. The more questions you answer, the better prepared you'll be. Stay positive. Confidence can make a big difference on test day.